How will new anticoagulants improve stroke prevention? Imagine a future where preventing strokes becomes easier, safer, and more effective. That's what new anticoagulants are promising for people at risk of stroke, especially those with heart rhythm issues like atrial fibrillation. Atrial fibrillation is a common condition where the heart beats irregularly, increasing the chance of blood clots forming in the heart. These clots can break free and travel to the brain, causing a stroke. To prevent this, doctors prescribe blood thinners or anticoagulants, which help keep blood flowing smoothly and prevent clot formation. Traditionally, warfarin was the main medication used. While effective, warfarin requires frequent blood tests to monitor its effect, and it interacts with many foods and medicines. This can make managing it tricky for patients. Now, newer options called direct oral anticoagulants, or DOACs, have entered the scene. These include medications like apixaban and rivaroxaban. They work by directly blocking specific factors in the blood clotting process, which makes their effects more predictable. One of the biggest advantages of these new anticoagulants is their ability to significantly lower the risk of ischemic strokes caused by blood clots in people with atrial fibrillation. Studies show that they are not only more effective but also safer than warfarin, with fewer serious bleeding events. They also don't require regular blood tests, making them more convenient for patients. Plus, they have fewer food and drug interactions, which means patients can take them with less worry about what they eat or other medications they are on. Starting anticoagulant therapy early after a stroke has also shown promising results. Research suggests that initiating DOACs soon after a stroke can reduce the chance of having another stroke by up to 30%. This early treatment approach can be a game changer in stroke prevention strategies. Of course, choosing the right anticoagulant depends on each person's individual health risks. Doctors carefully assess factors like the risk of bleeding versus the risk of stroke before prescribing these medications. Ongoing research continues to explore how best to use these drugs, especially in patients with complex health histories, such as those who have had brain bleeds in the past. In summary, new anticoagulants are transforming how we prevent strokes. They provide a safer, more effective way to reduce stroke risk for many patients, especially those with atrial fibrillation. But it's important to remember that these medications must be used under medical supervision, with personalized treatment plans tailored to each person's needs. Always consult healthcare professionals to determine the best approach for stroke prevention and risk management.